Hi, everybody, and thanks for joining us today. We are so excited because we are going to share some resources for your shelter to use for fosters or for your spay-neuter clinic. And we've got a great panel today. So what we're going to be doing is we're each going to do a short presentation talking about 3 resources that you can either use individually or tie all together. And then we're going to do some Q&A. So I'm Amy St. Arnaud. I'm with Best Friends Animal Society. I'm the Director of National Veterinary Outreach, and I will be your facilitator today. And I'm going to go around and introduce the rest of our panel. So Dr. Greenberg, if you would introduce yourself.
Sure. My name is Mike Greenberg. I'm a shelter vet, and I currently am the Director of Outreach Programs for Maddie's Fund.
And Dr. Julian Breton from BI and the Pet Pro Connect.
I am Dr. Julie Ryan Johnson, and I'm a shelter vet from BI. I run the shelter program for BI.
Hi, I'm Brenton Minish. I am the Customer Success Manager for our digital team here at Boehringer Ingelheim, and I work primarily with our Pet Pro platforms. So excited to talk to you all today.
Great. And Beth?
Yes, hi, I'm Beth Harrison. I'm the National Account Manager for Animal Welfare for Covetrus Distribution Company.
Okay, so we're going to dig right into it because we've got lots to share. So, Dr. Greenberg, so
Yes.
There are so many different terms floating around: telehealth, teletriage, telemedicine, VCPR. So could you get us started off by explaining some of these terms and how also, if you can even do any of these in your state?
Yeah. Can we even do this stuff?
Yeah.
I would love to. The word salad that we currently find ourselves in, I keep saying it reminds me of the Jetsons, because you basically put the prefix tele on anything and suddenly it's a thing, so we've all heard these, telemedicine, teleconsulting, things we've already mentioned, triage, telemonitoring, telehealth, and so on. And these things all really do have definitions, which is helpful. But I think I can definitely say that as I started getting more and more interested in this and using some of this stuff, I was confused. So fortunately, in this case, the AVMA has sussed out a lot of this for us. And I'm not going to go on the entire chart, but if you head to their veterinary telehealth website, in their basics, and you'll find this diagram that goes over all these sort of subsets. Today, we're going to really focus both in what I'm going to talk about here briefly, and then the other tools we're talking about on these areas: telemedicine and teleadvice/teletriage. So I'm just going to talk a little bit more about those right now and what they mean. So this is kind of one of those rectangle square situations. All of this is telehealth. Telehealth is the most general term here. It's the rectangle, if you will, maybe even the polygon. So when we're talking about this telemedicine versus triage versus teleadvice, really the question that follows is veterinary-client-patient relationship, VCPR. We'll talk a little about what a VCPR is in a minute, but when we start, so that's the first question. If we say yes, it is required, then we're in telemedicine. We're going to leave that right there for a second. If we're doing things that don't require a veterinary client-patient relationship, then the world of teleadvice. And of that is teletriage. I'm going to go over this in a little more detail on the next page, but so teleadvice is what, any of us who have worked in emergency medicine and in general practice too, have done teleadvice. Fluff is, I'm on the phone, Fluffy's shaking and it's the middle of the night and it's fine. She didn't need anything. He's, but I don't know what's wrong. Oh, okay. In my experience, it's 12 a.m. and there's a fluffy white shaking. She has generic fluffy white dog. She's probably okay, but I can't tell you specific to your fluffy. So, it's up to you if you want to bring her in. That's the kind of a version of advice, but I don't know scenario. I just have seen other dog fluffy. When I got into the world of, do you want to bring her emergency visit or not? Now I'm in the world of teletriage, which is, again, just I haven't met Fluffy, but I'm trying to help the client decide, or the foster caregiver, Fluffy needs for an emergency visit. Let's take the same go. Let's call it a telemedicine situation. I already know Fluffy, and calls and says, "Hey, you saw me, that seen each other, for 6 months ago or whatever. She takes these medications. Sometimes she gets anxious. I have this anti-anxiety med. She's shaking. For me to give her one. No other worrying signs." And so I said to the client, probably okay. It can probably wait till tomorrow, but I can't say for sure without seeing Fluffy. So, if you want to bring her in, but I certainly can't prescribe anything or anything like that. That's the realm of tele-advice, tele-triage. Telemedicine would be, I've already seen this client, and maybe I know this dog has some anxiety issues, and I've prescribed clonidine or something like that in the past, and the client says, "Hey, can I give her one of these," or something like that, and I speak with the client and say, "Sure," or I do a video chat with the client and say, "Sure," just as a simple example. So telemedicine needs a VCPR, tele-advice does not. I don't want to belabor the point. This is a chart that you can find on our Maddie's Fund Telehealth Basics blog, but really the big picture here is, without VCPR, you can assist with general interpretation of things like lab work. You can help clients make a decision about whether to take their pet to a vet sooner rather than later, and you can provide general information. You can say, "Hey, vomiting in dogs with no other worrying signs is often caused by XYZ," but I can't say, "Oh, your dog is vomiting because of X," without a VCPR. So before I finish this part up, just want to quickly talk about this idea of a veterinary-client-patient relationship, especially in the midst of COVID and the increased popularity of telehealth in all forms and fashion. VCPR has gotten a lot more attention recently. The veterinary-client-patient relationship is, in short, it's the relationship that provides the legal basis for a veterinarian to diagnose, prescribe, and treat a pet or a herd, in the case when we're looking at herd health. The establishment of a VCPR generally requires an in-person visit. And I've put generally in there, I could easily say almost always. But in the midst of the current COVID crisis, there has been some relaxing of those regulations. Most notably, I'll go all the way down here, the FDA, who has a federal level statement on the VCPR, relaxed its requirements. However, the state VCPR requirements still hold. And so if you want to know what's legal in your state, you have to just go straight to the source. And when in doubt, just email, call your state's VMA. Hopefully you can get a hold of somebody and ask. When interpreting these things, I can say from my experience with it, it can be challenging because there's a lot of vague terminology. You'll see words like timely. Well, what does timely mean? Does that mean a week, a month, a year? Sufficient. Does that mean that I read, a brief little paragraph on the, from a record from 4 years ago, or do I have extensive notes, and so on and so forth? So I wish I had some good silver bullet answers in terms of how to know what you can do under your VCPR and what you can't. But I think the best advice that I could give as it relates to this is to check out the AVMA's state-by-state VCPR pages and just keep up to date on this FDA link. That's updated regularly to find out what you can and cannot do. And lastly, if you have an existing VCPR with a pet or a herd, you're most likely in the clear, but I'm not a lawyer. Don't take my word for it. That's about all. I'll keep an eye out for questions, but I'll turn it back over to Amy.
I am actually going to give now an example of how you can use one of these. So mine is actually going to be our best friend's Vet Access app. And so this is actually a good example of the teletriage. With ours, if you don't have a vet on staff, or your vet isn't available or isn't able to handle after hours calls, this is a great way to take the burden off of your staff, off of your foster coordinator, off of your vet tech who might answer the phone for a spay-neuter clinic, off of your rescue coordinator. So that's really what our app is about. So the concept behind this is that it is actually a mobile app, and you can use it for the public. So you could use it for adopters, you could use it for your staff, or you can use it for fosters to call, video conference, or text. They get a licensed veterinarian that can be licensed anywhere, 24/7, 365 days a year. So you can download it. It's Android and Apple. And if for the public, it's for a small monthly fee. But thanks to Maddie and them really helping us out, they actually provided funding so that we are able to offer this for free to all fosters. So if you are a shelter or a rescue and you want your fosters to sign up for this while supplies last, you actually are able to sign everybody up. There is no limit on the number of fosters that you can sign up, and you can get this app for free. So the way it works, this is an example you can see on the picture of what it would look like once you have downloaded the app. It's really simple to use, where you can either upload pictures of your pets or your foster animals. You can call the vet. So it's a very simple thing. And so the foster basically contacts the vet using the app, and the vet is going to be able to advise, is this something that you can handle at home? And what can you do? If it requires an in-person vet visit, or if the foster needs to seek immediate assistance at an emergency clinic. So they can answer basic questions like Dr. Greenberg said about medical, dietary, behavioral questions, but they actually cannot prescribe medication via the app. They can actually not diagnose. So this is basically a triage where they are giving advice, but they are not prescribing specifically for your pet. The nice part about this is that when you sign up, your organization's portal keeps records of all the calls and the vet recommendations for each foster or your animal. So you'll actually be able to go and see what was suggested and recommended. So of the vets that are helping, we get this question a lot of, well, who are these vets? Where are they coming from? So there are 80 licensed veterinarians who participate. They do have all at least 5 years of veterinary experience. And the app is actually translated into 110 different languages. So if you are, the vet is English speaking and the person is Spanish speaking, it will actually translate so that they can communicate back and forth together, which is really nice to be able to offer, especially if you're doing a lot of outreach or you have diverse fosters, which is wonderful. So here's a success story we just wanted to share. This actually came from Pima Animal Shelter. And so one of their fosters actually had to use this. The kittens were 11 days old and they weren't sure what to do. So they video chatted with a vet and they were really able to just reassure them. And I think that's really a lot of what this is helping you not have to get calls at the middle of the night as your foster coordinator, because especially with COVID, we've seen a lot of new fosters come on board. A lot of people who are first time, who've maybe never done this before, who are getting kittens, who just need that little extra reassurance of what should they do? Is this okay? And that's really what this can help provide. And a lot of time it can help save you money by them not running to the emergency clinic in the middle of the night, by saying, yes, this should be okay till morning, till you can talk to your foster coordinator or till you can get to your regular veterinarian. So here's how it works. So if you are an organization and you want to sign up, you can go to this link and you actually then will follow. There's an instructional PDF that will be right there, and it shows you how to add fosters on. And then you will sign them up, and then it will send a coupon code to their email for free access. And then it will show the fosters how to sign up, and it will explain what this is so they know what they're doing so that they can log in and then use this app. You can also use the app not only from your phone, but also from a computer if that's easier. And it should really only take a few minutes from the time you do this to the fosters getting their coupon. So then on the foster side, they'll get this coupon code and they'll get their instructions. They'll download the app. They'll enter in their coupon code that lets us know that it is free, that they should not be charged. And then they'll be able to activate this, and they can add their pets, their foster pets information. They can also, if they're fostering multiple pets, they can do multiple pets on this. It's not just limited to one. And then if they ever need to connect with the vet, basically they just click on that call vet, and then they'll get the option to video chat or text with the vet directly. So we do also have an option for adopters. There is a fee for this. It is $12.99 a month, but there is a really cool feature, which is for $15.99 a month. It's called the Emergency Protect, and basically it gets them not only the unlimited access to reaching a vet, but it also provides up to $3,000 for an emergency vet bill. So if they actually use the app and talk to a vet, a Vets Plus More vet, and the vet says, hey, you need to get your animal in for emergency treatment, they will actually process the payment and pay directly to the emergency vet up to $3,000. Now, you can have up to six pets listed on this, but you can only use the $3,000 one time a year. So if you only use the bill for $300, then you've used your time. But otherwise, this is like a really great opportunity if you do have a situation where it's all of a sudden an emergency situation, $2,500, and somebody doesn't have that, this can be a really nice resource for them. So what I love so much about what we're doing today is that each one of the things you're going to hear about can be an individual thing. If you just need the vet access app because you don't have a vet, you can use that. Or what you can do is you can tie it into the other ones you're going to hear. So Pet Pro Connect, which is going to talk about how you can connect if your shelter or rescue or spay neuter clinic has a veterinarian on staff, you can use that for this. And then you could even just use this for if your vet wants to take a break or is on vacation, you can have the Vet Access app as a connection. Then you can use the Covetrus Shelter portal to be able to send out medications. So for your spay neuter clinic or your fosters, so that they're actually able to send that out directly and with physical distancing, not having to come in. So I love that all three of these can be standalone or can be tied in together and giving you these free resources. So now I'm going to turn it over to Brenton, and he is going to be the most tech savvy of us, and he is going to show some really cool stuff on Pet Pro Connect.
Thanks, Amy. I appreciate it. Yeah, so a couple different things here that I'll show you. Let me start by sharing my screen. So the first thing I just want to point out is that you've heard Pet Pro Connect, and I'll be talking about another platform today also called Pet Pro Teleplus. I just want to make sure that you understand that there is two different platforms that we offer through Pet Pro and through Boehringer Ingelheim. One, the Connect keyword there is a integrated platform that we are working on getting everything set up with most of the high-use shelter softwares out there to get that up and running for all of the shelters out there. We're not quite there yet, so we have another platform called Pet Pro Teleplus, which I'll be demonstrating today, which is a 5-minute setup telemedicine solution for any shelter that wants to use it to interact with their fosters, as well as deliver content. So this is our main webpage, petproteleplus.com, and from here you can launch Pet Pro Teleplus to sign up. Signing up's real easy. You just put in some information here, create a password. You say that you're a veterinarian, and then you do need to put in your license number for a veterinarian on staff to create your account. Now, let's show you a little bit of what the platform looks like once you're set up. So what I have here are two different views. On the left-hand side, you're going to see the view of a foster or pet owner, and on the right-hand side, you're seeing the shelter veterinarian or shelter staff view. Now, what I'll talk to first is the shelter view. So the way that the app works is you're seeing it on a browser. It works on any device. It's really friendly across all devices, and within the next couple of weeks, it will be a full-fledged application on the App Store to download. The best part about this, guys, is it is absolutely free to use. There is no cost associated with this. There is some small fees that apply if you're charging a foster for a consultation with a veterinarian, but that's the only time there's any really money that exchanges hands with this. Now, there's a few things as a vet you would do when you get set up here. If you go into my settings, I'll just quickly talk through those. You'd first associate yourself with a foster or clinic. So you can see here, we've got an example of Lifeline Animal Project. You can be attached as a veterinarian to different shelters or clinics if you work on multiple ones. But the idea here is this is a vet's account. So from there, you can connect to different clinics, or you can click here to add or join a particular hospital. This is just using Google Places to find a clinic out there or a shelter that you can connect with. Once you've done that as a vet, if I go back to my settings, you'll set your rates. Now, if you don't want to charge, let's say, your fosters for doing any consultations, you can easily set these prices to $0 and be able to offer no-cost video or chat appointments. But right now, the way that it works from a foster side is you would still need to put in your credit card information. Just you would see that it's no cost. In the future, we're going to have that optimized so that you can even offer it as a no cost with no credit card information that needs to be input there. So once you set these rates, as you can see, there's two different types of appointments, chat only or video, and you'd save those settings here. After you set your rates, the last thing you would do, one of the last things you would do is just decide how you want to get paid. We use this portal called Stripe Connect. So if you do want to receive payments for these, it takes 5 minutes to get that set up, and you just put a bank account or a card information for where you want your payments pushed directly into. The last thing you would do is open up time slots. So you can see here that there's a My Schedule button for the shelter, and then what you do, and some of these pictures, I apologize, aren't loading, but you would add a time slot. And you can add any amount of time that you would like to open yourself up for folks, for fosters to schedule appointments in 30-minute blocks. So if I want to start from 1 o'clock p.m. all the way until 5 p.m. saying I'm available or we're available to do these calls, you can do that. And then you can select here the shelter that you're going to open those slots with as the veterinarian. You hit Add Time Slot, and it'll create those time slots for you. And now as a pet owner, if I have the TelePlus app, I can find your shelter, I can find the shelter if I'm a foster, and I can see the time slots they have available and request an appointment during that time. Now, let's go back over to my dashboard here real fast. This is the view. Again, I apologize for these pictures not deciding to load. But this is the view that you would see as you're kind of using the platform as the shelter. You're going to have some things up here that show upcoming appointments, previous appointments, and how many open slots you have that week. One thing I really want to focus on is this really unique tool called telecasting. This is a way that we're going to allow you to push out educational content to the actual fosters that you have that you work with. So let me move over to the foster view to show you a little bit of what that would look from their point of view. So we're moving from the shelter view to a foster or a pet owner. Now, as a foster or a pet owner, one really cool thing about this is, as I mentioned, some of the educational content you would be able to make available for them. Here's an example of a telecast that we made of how to tube feed a kitten. You'd be able to decide if you create a telecast. So if I go to telecasts, I'm set up to be able to create them here with this account. And you can see here, you can create a name, description, the date you want to notify everyone that it's available, and then the date that it'll actually go live for people to watch on demand. And you can target this to have just available for pet owners, available to your vets that are associated with your shelter. You can even make it available for any vet that has the platform. At some point, we will open that up for folks to do. The first iteration of this, if you get signed up today, it's not going to be fully launched. We're allowing select industry experts to create content for these telecasts in the near term. But in the long term, you will be able, as a shelter, to create your own content and education and anything that you think that would be a good way to deliver anything through this platform that all of your fosters or vets already have in their hands. I'll show you a little bit of an example of what one looks like. The videos are not actually loaded on here. But the way that it would work is you would have a video here that would play. And then if I use another example here, underneath these actually, you'd be able to post information and have all sorts of different information that you put underneath the actual video. So if you see, for example, now that it's loading up for me, you would play the video, and then underneath here, I could post links, I could post PDFs, anything that goes along with the education that you're delivering, you'd be able to add there. Now what I'm going to do is just go ahead and, as I end here, show you a little bit of an example of actually doing a consultation. So you can see that we've scheduled one for right now. So we'll go back into this smaller view. I do want to point out that previous to an appointment, if you have one in the future, there's an appointments details page that's really useful for a vet to post information or for the foster to post information specific to that appointment. But if you want to go ahead and start that, all you do is at the scheduled time, you hit the little call button here to join the appointment. You're going to see that it starts there. It's going to take a second to connect, and then you'll see me pop up there. And then you can call here on the shelter side, and you're going to see me on both sides. We talked about VCPR today. This is going to always have a little pop-up just acknowledging that VCPR guidelines may apply. And if you need to go to that AVMA website we referenced, you can do that there as well. Otherwise, you hit yes, continue, and from there, the call will start. So it's going to go ahead and load up. You're going to hear me echo for a second as I mute. But you can see very easily how this would work. And you would be on a phone, obviously, as opposed to a computer, and be able to move it around and clearly show what's going on. After the end of the appointment, You would have the opportunity to, if it is a paid call, go ahead and submit that payment, or you can discount the amount all the way back to being a free call if you need to. And that is PetPro TelePlus. I urge you to go to our website to sign up today. If you have any questions, we'll answer them here in a moment. But I will go ahead and pass it on now to Beth.
Yes, thank you very much. I'm thrilled to be able to present to you Shelters for Fosters. A little bit about Covetrus, just before I get started in the program. For those of you who might not be aware, Covetrus was started in February of last year, and basically Henry Schein Animal Health spun off from Henry Schein, and Vet's First Choice purchased Henry Schein Animal Health, and we created Covetrus. So one of the opportunities that this provides to our community is not only to be able to give the distribution business that we have available, but also bring in the technology pieces to it as well. So we have everything from bringing it all together, from being able to offer you products and services that you're used to, compliance, engagement, specialty compounding, exclusives, as well as analytics. Shelters for Fosters was actually brought to our attention. It was actually an ask that we had from one of our animal welfare partners because of the need. One of the things that I like to believe, because I am a Pollyanna at heart, is no matter how challenging the situation, there's always something that you can learn from a situation and be able to take that learning and expand on it. One of the things I like to believe is going to be a positive for us all through the COVID-19 pandemic is the ability for our fosters to be able to be such a wonderful community network and to be able to reinforce that. So that's one of the reasons why we looked at Shelters for Fosters, to be able to help you increase your compliance, maintaining the medication, and not only understanding the food that is being given to your fosters, as well as contactless delivery method and reduced costs. We have auto ship discounts as well as manufacturer codes that will be available through this platform as well. We also, of course, the VCRP requirements need to be met in order to go ahead and set up an account for Shelters for Fosters. We do have to have a licensed DVM that is affiliated with your facility. We'll need to be a 501c3 or a government not-for-profit entity and have a credit card for all purchases through the portal. The opportunity for this is to be able to, we took our fees to set up any store and removed them for you. So we wanted to make this as cost-effective as possible, so we removed those barriers for you. We have thousands of different supply products of everything from food to medication to compounded medication right at your fingertips. And also mentioned the auto ship option is also available. We have, obviously easy ordering will help with compliance. We want to make it as easy as possible for your fosters. Once you have the foster set up in the system, it's very easy to reorder. You'll have the ability for renewal management as well as creating new prescriptions and reviewing for multiple dosing strengths. For an example, if you have any of your fosters or even any of your animals that you have in your care on multiple doses of medications. I know we had one situation where someone had one of their cats on 5 different pills that had to be given twice a day. And I know pilling a cat's not fun. I have several, so I know that that's not ideal. What we were able to do for these customers is be able to take those 5 different medications and combine them where we're able to. So you can talk to our pharmacist and get that type of product combination. So then instead of having to pill 5 pills twice a day, they reduced it to 2 pills twice a day. So there's different opportunities that we can provide to you to help you with your compliance. We also wanted to make it as easy as possible for you to enroll. This is the enrollment link. It will also be added to our chat here in a moment, as well as available after the meeting through our follow-up notes. There will be a concierge service that is available for both yourself and your fosters. Will be able to call a specific 800 number, be able to speak to a pharmacist. So if your fosters or yourself have any questions about any of the medications, any type of interactions, you have that 800 number that is specific for you, and you get directly into a pharmacist. The weekly Zoom training is also set up. So once you enroll, it typically takes from when you fill out the form to actually getting an active portal is typically about 3 to 5 days, and depending on demand, obviously. So hopefully you'll be getting an email from me a little bit earlier than the 3 to 5 day time frame. And then we will get you set up for the weekly Zoom training session. Also wanted to touch base on some of the other programs that we have available through our traditional distribution method. We have several different partners that we work with to help reduce your cost to help your animals, because from a Covetrus perspective, the more money that I can save you, the more animals you can save. I do want to also, if we have the time, I want to be able to also show you the webinar that we have, a little bit of a training module. And let me get the right screen up, so bear with me a moment.
First time they're going to order, we're going to have to create a new one. So let's go ahead and add a new pet. And we'll do, let's go, lady. She'll be a dog. Breed. We'll say she's a cattle dog. Weight, 50 pounds. Female, and we can go ahead and just take a guess here. And we're going to have a veterinarian on file. We can add more than one. They can be delegates for each other, but we'll go ahead and just put whatever veterinarian is prescribing this. And then obviously if you want to update allergies, health conditions, current medications, anything you want to be able to see at a quick glance when you're sending them out more products, go ahead and update that, and then we'll just save the pet. All right. Now we have them all set on auto ship. Just go ahead and put 4 weeks on there. Let's add lady to all of these orders. And that is set. Veterinarian is not going to decline it because the veterinarian is making this order, so we'll just go ahead and continue. I apologize for my slow Wi-Fi. I've got 2 kids homeschooling right now, hogging up my internet. So this is what's really important. This is where we're going to add a new address. So this is going to be the address of wherever it is that you're sending it to. So we're sending this to Charles Hunley. We'll go ahead and say 40954, my address, and we will continue. So that's where it's getting shipped to. Three to 5 days is free. And payment. And this is where we're going to go ahead and just put a payment of card on file for each individual shelter. You just a MasterCard. We'll go ahead and put that information in. We'll click Save Payment Information, and then you are just going to have to make sure we uncheck that box and just put the shelter billing address in there. And then we won't have to do that again as well. And then just click Review My Order, and then we send. Pretty simple. Now the next step and the last step that you'll have to do before going back to managing your auto ship, you're going to just jump over here, and what that's going to do, you go to your home screen, it's going to activate as if the client was purchasing it and you have to approve it because they're prescription items. So it will pop up on here. This would say lady on all 3 of these, the one we just did. Obviously it would be the products that we just did. And I just go through and click approve, 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 and it ships out and we are done. Now, if I went back and you did want to change that auto ship and you didn't want it, you know, we were just doing it because we wanted to incentivize the discount, but we weren't certain if they're going to need it for the following month. All you do is go into this account for the shelter account, and you're just going to go into manage auto ship. And at that point, you can go ahead and you can turn them all off, or you can push them further out, however you'd like to do it. But once they go ahead and ship out, that's when they'll become optional for you to for you to manage. So hopefully that was helpful and that was easy. Obviously, that's going to be the longest version of it, unless you happen to be sending 3 different products, including a compounded product. But just know on those compound products, SpeakCap accredited, largest compounding formulary, should have everything you need. But at any point that you've got questions, like I said, Beth will contact me and I can walk you through one-on-one. Thanks so much for joining, and have a great day.
And that just showed you a little bit of how easy it is to be able to go ahead and set up one of your accounts, set up one of your fosters, and then those fosters will remain in the system going forward. Thank you very much.
Great. Okay. Thanks, everyone. So I saw a couple of questions come through, so I'm going to kind of go on to those, and everybody else put more questions in if you have them. So one of the things I did want to mention, so we have Leedy Van Cavage from our Best Friends legislative team is on, and I saw her earlier posting in the chat about some things coming, some changes to California, Telemed, and there's been some other states that have made some changes. She did let me know that if anybody is concerned about their state or isn't sure, has some questions, that she is happy to either try to have our legislative team answer based on the states that they represent, or connect you to a person in that state who can help you. So, and then the other thing we did get a question from Christy asking about, she was particularly asking about the Pet Pro Connect, but in particular, you know, it seems like that might take up a vet's time. Can other staff do it like a vet tech, but what does that mean in terms of a non-vet giving medical advice? So, and that's something I've seen. There is, by the way, just as a great resource, if you go on Facebook, there's a veterinary telemedicine Facebook group that has some great information. They talk a lot about like how to make this work, how do you handle when you're busy, how do you schedule these appointments? So that's a great resource. But I'd love to open that up. So maybe to Dr. Greenberg, to Dr. Julie, to Brenton, what would you guys say to that?
Well, I'll say what I typed to Christy, just to be fair. I first said I'm not a lawyer, so I'm very glad that the Best Friends legal team is available to me with a wet noodle. But when I was, doing this stuff, regardless of the tool being used, whether it's Pet Pro Connect or a telephone or email or whatever, a tool isn't as important as what you're comfortable with your trained staff doing. And so my answer was essentially if there are areas of advice giving that you're comfortable having, say your vet tech staff, your assistant staff, foster coordinators giving, then that's okay to do over one of these video chat, integrated telemedicine platforms. If you're not comfortable with that advice, nothing changes with that given the platform. So the important part is what you're comfortable with, not as much the tool being used.
And I just want to add, the tool can also be used for other things like behavior. So if you've got a behavior team and a dog is newly adopted, whether it's a foster or a new adopter, and they're having some issue in the home, it's so much better to see it happen in the home environment. I think that's really, really cool about that. And when you do adoptions, you can give away like a packet of, you get one free behavioral advice or something like that, but you can also monetize that too. You can, give one away free and then sell 3 for a certain amount if you'd like. So that's completely up to the shelter how you want to use that telemedicine. Keep in mind, it's great for fosters, it's great for new adopters, it's great for behavior, and there's probably 10 other ways we haven't thought how to use it. And then in your hands, we'll hear some really great results.
Well, I'm going to follow right up on that, actually. And I'm going to ask you a question from Maria, who is a spay-neuter clinic only, and wondering about how to use Pet Pro Connect, in particular doing curbside drop-off and pickup. They're calling all owners with discharge and collecting credit card payments over the phone. It's a very lengthy process, involves a lot of staff to complete. They're doing about 80 animals a day. So do you have any thoughts on how a spay-neuter clinic could use that?
Yeah. I'm going to start, and I'm going to have Brent get into the technical. Hi, Maria. This is actually an app that the Pet Pro team has been really interested in working with the high-volume, high-quality spay-neuters and the shelters on how to keep you all safe. And there's some really good tools that were coming out. Keep in mind, we launched the Pet Pro TelePlus about 2 weeks ago because we weren't quite integrated into all the shelter software systems. So it's kind of a tool in process, and there's a lot of great features that are coming. And I'm going to turn it over to Brenton to talk a little bit more technically about what those features are.
Yeah, so great question, first of all. And as Dr. Julia mentioned, we are working with some spay and neuter clinics now to try to understand how we can make this platform better utilized for those situations. I'll tell you, everything that you guys saw for Pet Pro Teleplus today was developed in 30 days. It did not exist 30 days ago. So if you can imagine what we can do with some input from folks like you in this industry to create a platform that works for even more specific situations, we are dedicated to doing that. And right now, some of the ideas we have, I'll tell you, is some of the things that, if you're familiar with geofencing, sorry about that. I had something pop up here, start my video. Oh, sorry about that. I didn't realize I still had that off. So the geofencing, and so the idea would be you would pull up to a spay neuter clinic. You could be prompted on Teleplus, for example, to sign in, and to you can even use that as a way to kind of walk them through the process, tell them when to come in, and tell them the step that their pet is at in the spay neuter clinic, and then be able to do some type of follow up afterwards as well. But helping you really use it as an operations tool to help move the pets through the steps of the spay neuter clinic and be able to keep the pet owner involved through the app at every stage of that. Now, right now in its current state, what I would actually say is for you to be able to use it to really interact and have those chat appointments and have some of that post-appointment conversations and educational content through the telecasting possibly be able to be utilized for some of those things. So that's, and as we said, it'll be much more better utilized, I think, for those specific spay-neuter situations once we get some of these new features added, which shouldn't take us long to do.
And I really see it also being utilized right now in its existing form for rechecks, because right now one of the concerns is bringing people back in the building for rechecks. And so if the veterinarian can do that remotely and answer that questions, and then if they do need to give any medications, they can use for refills, they can use Covetrus to do that. So I think that's a great way right now to do and a lot of people are already doing that, but they're just doing it on their cell phone. So instead of having to go out your personal cell phone, it's kind of nice to have this app. And then it also has kind of the record of it. And I think it is interesting that you guys are having it tie into the shelter software and possibly spay neuter software, because I think that's unique versus just a lot of the private practice software. So I think
and once we get those shelter softwares up and running, it'll be really neat, because what people for your curbside folks out there that are struggling with that right now, you can go on and you can probably Google actually Pet Pro Connect, and there's some news articles of clinics using the Pet Pro Connect, which I just want to clarify, Pet Pro Connect's not what I showed you today. It is our fully integrated platform that has much more than telemedicine. What you saw today is Pet Pro Teleplus, but once we have the softwares installed with some of the shelter softwares you guys use, it'll allow you to have a two-way messenger, so they can tell you they're outside. You can actually have the pet come in, the pet owner stay in the parking lot, and the pet in the exam room or wherever they're examining the dog or doing something with the pet. You can have Pet Pro Connect up on the doctor's computer, and I as a pet owner can be in my car still watching the staff interact with the pet. And see some of that and still feel involved in that process. And that's what folks that are at least general practitioners that are using this right now, that's how they're using it to really optimize that curbside service, not having to call the clinic just to let them know you're there and tie up the phone line. They just use the messenger, and then they feel involved in their pet's care still, even though they can't come into the hospital.
And I just want to reiterate, it's free. So those platforms, the Connect and the Teleplus, are free, because I'm getting a couple texts about that. So I just wanted to reiterate that.
Yeah, and these are, and Vet Access is as well. And we've used the Vet Access a lot during disasters. So like we actually opened ours up during Hurricane Harvey, and we're getting like 2,000 calls a week, because it was a time when people just couldn't get to their veterinarian. And so I think these platforms can be used in a variety of ways. And I think that what we're finding through COVID is that it has changed, and probably things are not going to go back to the way they were before as much. So what can we take that we really like and really grow forward to use technology in a way to still really connect with people? And I think these are some really unique ways to do that. So I'm excited about that. So Dr. Crawford did have a question about, is the VCPR relationship interpreted differently for foster pets that are technically owned by the shelter versus adopted pets in a new home and owned pets seen at spay neuter and wellness clinics? If so, this may affect how and who utilizes telemedicine.
I can take this, but again, I'm not a lawyer, but I do know that California does have a different bend on that as far as who actually owns the animal. So that's kind of, we wimp out and tell you to, look at your AVMA directory on what is considered the VCPR. And Levy, that's awesome that she's there and can help, with that point too.
Yeah, I have to say, Leedy rocks, and she's really been so good at her entire team has really been on top of this. They've been monitoring all the legislation. They've been really seeing where regulations have been relaxed, where they haven't been, and really keeping up to date on that. And again, if it's not something that her team can help with, she's willing to try to see about connecting you with somebody in your state to answer those questions. But I think that a lot of times what we're seeing in the shelters is that if the vet has seen all of those pets and initially did their, again, you have to check with your state and make sure, because some states, in terms of what time frame, is it a year? Is it, are they having to be seen for the exact same issue? You will have to look at all of that to see, but usually if the vet has seen that animal, then as long as you check with your state, that could be considered a VCPR. So always good to check with your state directly. But Dr. Greenberg, did you have anything you wanted to add?
No, just that idea of where the shelter ownership comes in is always a sticky issue, especially when you layer on top of it the fact that there is some, I put this a lowercase p, again, not a lawyer, there's some precedent in terms of when we look at herd health and the VCPR that exists when you're looking at when you're familiar with the whole, when you're doing cattle or whatever, that you don't have to know every single cow in the herd to tell the farmer to do something. But I don't know anything about how those things necessarily translate legally to the shelter world. So I would defer to the legal folks on that, because that is certainly a sticky spot.
Well, and this is definitely something that there are strong opinions on both sides. So we definitely want to make sure that you are, I don't want to sound like we're not answering the questions, but we definitely want to make sure that you are checking and being very careful in proceeding. Bruce did share that the VVCA, the Veterinary Virtual Care Association, is another good resource. And it's free for everyone, vvca.org. So that sounds like a great one to check out. And then we got another comment. Many shelter vets cannot continue to serve as the veterinarian for their adopted pets unless they have a permit to serve as a vet clinic. Yes, that is very true. And Leedy has said, unfortunately, herd health usually doesn't translate to dogs and cats in shelters.
There you go. That's helpful. Thank you.
Oh, so I just want to make sure that we've put out in the chat how to get more information on all of these. And I know Allison is going to be sending out an email tomorrow with a follow-up that tells everybody, basically has all these links. It'll have the presentations, it'll have all the links. So all the correct links in there. We'll have pretty much everything in one spot. So, and also how to get more information, how to do demos. So if you're interested in either one of these platforms or all three of these platforms, basically how to make that work. But Beth, I had one question come in before, which was, so in terms of the types of products to get through Covetrus, can you get most of the items that you would use in a shelter setting, or are they mostly for private practice? So could you talk a little bit about things like mostly, I know a lot of it's the same, but things that you might
Right.
get.
Yeah, they're obviously, Covetrus, the main driver is our traditional veterinary clinics. However, we do understand how important our animal welfare organizations are, so that's why they created me. To be able to be focused specifically on this market. So we have over 90,000 products just through distribution. So there pretty much anything that you could need, we would be able to provide. So it's everything from medications to vaccines to the needles and syringes to rescue to whatever products you need, heartworm preventatives. And then put on top of that the fact that we have the specialty compounding and I don't even want to know what the numbers are for the products and services. But if anybody has any questions at all, feel free to either reach out to me personally, pop a note to your local representative. We have territory managers and inside sales reps waiting to serve to see what questions they can answer.
And could you just mention really fast, because I'm not sure everybody knows the compounding. So can you talk about that being Roadrunner and?
Yes, I'm sorry. Yes, so part of the whole, thank you. It was part of the whole new Covetrus name was actually Roadrunner and Atlas were actually part of Vet's First Choice. A lot of people didn't realize that. So we actually have one of only two 503B facilities in the country, which basically what that means is we are licensed to provide pharmacy grade products for animals. And there's only two facilities like that in the country that are licensed specifically for animals. So it's a great opportunity for us to be able to service this market.
And I'm just going to ask one more question to you, Beth, because so you already have, there are a lot of shelters that are already using Covetrus for an online pharmacy. But so you already have that option, but now you've got this, which is more of the shelter portal that you really kind of created based on a conversation with a shelter and then kind of coming in with us. So could you talk on this a little bit about that?
Yeah, so if you have the existing portal with Covetrus, which basically cares for a lot of the traditional, if you have a wellness clinic, is traditionally who would have a portal with us, and can handle all of the traditional client-patient relationships and services. What we can do with this portal is there was a tweak to it, of course, because when you have your online pharmacy, the customer is placing the orders, the customer is paying for the orders, and then you're just approving the prescriptions. So we kind of, again, similar to what Brenton said, we heard the need, and with rocket speed, to be honest with you, I was shocked how quickly we were able to get it up and running. Within a few weeks, we were able to get this up and running to be able to kind of flip that and have it be that the shelters are the ones that are placing the orders and approving the orders too, because they have to prove their own prescriptions, and the shelter is the one, or the facility is the one paying for the product. So the foster does not go in and say, "Ooh, I want to order a 12-month thing of, a heart guard or whatever." They're not doing that. It's all driven from the shelter out.
Yeah. So how long is it taking the turnaround? Because I know for a while with COVID, there was definitely everywhere was having long lengths. So how long is it from the time that that's approved by the vet? How long does it generally take to get to the foster?
The products themselves, actually, it's exciting because we have, of course, with COVID, there have been some delays in our receiving. Typically, we have been running about 5 days, but we just got notification yesterday that we will be up to our regular time frame, which is within the 48 hours of delivery. So between 24 and 48 hours by I believe it was June 17th, they said. So it was very exciting.
Okay. So then the last thing that Edie says, thank you. So I think the last thing then that I kind of want to say that excites me is that I love that 3 different resources kind of came together, but that all of these are trying to be really responsive still. Like we're still trying to build it out. We're still listening as to what is or isn't working. So for instance, I know with Best Friends Vet Access, thanks to the Maddie partnership, we're not only doing a survey to see if people like this, how it worked for the fosters, but we're checking in with the shelters to see, is it easy to use? Are you liking this? How is this going? So we're trying to really build upon that. And I really liked what Brenton was saying about how, hey, we're still trying to build this out. We want your input. So I think that there's some really exciting things there. So I'm really hoping that you guys feel this way as well and that you really like it. We're really excited about this and where this is going to go, and that hopefully taking away again the bright spots from the horrible COVID of maybe these are going to be some good things that help move us forward. So with that, I think I don't see any more questions in there. Thank you guys so much for joining us today, and we hope we'll hear from you. Thanks a lot.